Hi, my name is Jay Short. I'm with the Tennessee Board of Regents Ready to Teach program. Today I'm here with Dr. Michael Hosokowa. He's from the University of Missouri School of Medicine. He is the Associate Dean of Curriculum there and is a leading advocate for problem-based learning. We've constructed a few questions for him to answer today, and we are delighted to have him here with us. Dr. Hosokowa, we were wondering if you could provide a general definition of problem-based learning.
I think the basis of problem-based learning is the problem, in that all of us, life is about solving problems. And so what we've done is to take a lot of life's problems, in this case medical diagnoses, and put them into a case kind of scenario where students can learn from solving the case or solving the problem. So basically, problem-based learning is really inquiry-based learning or inquiry style of learning, where students get a scenario, they analyze it, take the key points, and then develop their hypotheses, test out their hypotheses, and come up and revise their hypotheses, continuing on until they've gotten an answer that they're satisfied with. In the case of medicine, it's taking a patient presentation, developing a list of possible diagnoses, using tests and so on to either justify or reject hypotheses or revise them and finally come up with a diagnosis.
I understand that problem-based learning has been a major component of the School of Medicine at the University of Missouri for many years now. How do you feel that problem-based learning better prepares these students for their professions?
Well, it's based on the premise that the half-life of biomedical knowledge is about 6 years. Now, for medical education, then, this means that by the time a physician is in their 6th year of training, about half of what we have taught them is now obsolete, incorrect, or simply out of date. So we are basically teaching tomorrow's doctors, today's knowledge. And that doesn't make a whole lot of sense. So what we're trying to do is to give them the tools to continue to learn, lifelong learning, and to continue to solve problems rather than memorize huge amounts of information. The other issue is that computers are now the external brain. You can Google something, although Google's not a verb, I don't think, yet, but you can go to one of the search engines and almost instantly find an answer to something, whereas before you had to memorize it. So right now, if you wanted to prescribe a drug and you did not know that drug off the top of your head, you would have to go to a book and look it up, get the right dosage and the interactions and so on. Or you could go to your computer and use the search engine, get valid information almost immediately.
So it's not really, you are looking for the solution. Ideally, you want the people presented with these scenarios to come to the solution, but it's really about strengthening the learning process, skills of critical thinking, problem solving. It's more about the process of getting there than it is actually getting there.
Absolutely, and the students accept that because the initial presentation of the patient may have these symptoms, headache, sore throat, so on, so on, so on. And some student in the group will stand up and say, or will put up their hand and say, my Aunt Minnie had those symptoms and she had Tsutsugamushi fever. And that may have solved the case in the first 30 seconds. But the students will remind each other, we're here to learn the foundations that go into this case and not just the diagnosis.
I described a few of the benefits. What do you feel are the largest benefits of PBL as a learning method?
Fun. If practicing medicine is fun, then learning how to practice medicine should be fun. And this is a lot more fun than sitting in 40 or 50 hours of lecture a week.
Absolutely.
The other issue is problem solving is an active learning process versus a passive learning process. And so where it fits, it is really interesting. The students learn to communicate with each other. They learn to throw out an idea and have it modified or rejected in some cases. They learn to work as a team. They learn to cooperate. And we have seen a major increase in their knowledge base. But even more important, I think, is the fun issue.
Do you think in the near future or in the future that we'll see more education programs, medical programs, instructors, professors using problem-based learning as a learning method? Do you think it's going to be more prevalent as time goes on, as it catches on?
This is somewhat controversial because if higher education and professional education continues to go in the direction of a business model, problem-based learning is high quality and very expensive. You can take one professor and put him in front of 600 students, and that's very efficient. Not very effective, but it's very efficient. So as long as we are going to persist in using the business model for higher education, implementing PBL is going to be tough. The other thing you have to do is to break down the silos. Somehow, the people in one department have to be able to talk to the people in another department. We have these silos that have been built up. If you don't have my degree, you can't have my knowledge. And there has to be an integration of the faculty so that they can share ideas. And this is really student-centered learning. Mm-hmm. But the short answer to your question is, I think that because of its effectiveness, you're going to see many schools go to PBL and be very successful at it. But you're also going to see a lot of schools using the high use of resources as an excuse not to do it.
But we need to implement PBL.
I think so, because life is about problems.
We're seeing the phrases 21st century classroom and 21st century teachers being used more and more. Do you feel that problem-based learning is part of the definition of this new 21st century teacher?
No. It's more characteristic of Socrates and Plato. That's the way they taught. I can picture them sitting under a tree talking to their students and asking questions and drawing out knowledge. I don't think there's any difference between the way that Socrates and Plato taught and what we're trying to do today. It's just a different setting, a different century. And so, yes, in some ways I think that PBL is kind of the method of the 21st century, but we have to remember that it's been around a long time.
It's nothing new. That's the
Right.
way we've learned. And one last question. How do you see problem-based learning being used in teacher education?
I think that problem-based learning can be used in any kind of an education setting. Certainly law has made a lot of use of case-based learning. Medical schools are using problem-based learning. I'm seeing some nursing schools and allied health profession schools begin to use problem-based learning. I think it's natural that problem-based learning be used in colleges of education. Teachers are all about problem solving, and there are lots of things that teachers can learn through these cases and discussion of the cases. What problem-based learning is really simulation. So simulation has been around a long time. Rather than put the pilot behind the controls and say, go up and fly a little bit, see how you like it, we put them in a simulator, and so if they crash, they don't get hurt. With teachers, we put them into a situation where they're trying to solve a problem, and they're learning teaching rather than learning about teaching. And I think that's the issue. It's simulation. They can now do it in a safe environment and make all the mistakes that they can, and they can see the consequences, and they learn, but they're not going to hurt anybody.
So problem-based learning, however it's used, will help people learn how to become rather than just learning about.
Yeah.
Actually becoming a word
Right.
assist. Okay.
Puts you in a situation where you are the teacher, and you are faced with this situation, and you must solve it. And so it's learning teaching rather than learning about teaching. The other part of PBL is that it is just-in-time learning. That is, you learn things when you need it, and you can apply it and use it. And that way you retain it. That's much more effective than just-in-case learning, just in case it's on the test. The state of Tennessee and the Board of Regents are well on their way to transforming education in the state of Tennessee. I think that this is going to become a model for the nation. And the work that the Tennessee Board of Regents has done, and the state colleges who participate in this project have done, this is really exemplary work. And I think that nationally people are going to be looking to the state of Tennessee as a model, and the people here have done a marvelous job, and all they're going to do is get busier.
Dr. Hosokowa, those were very kind words.
Good.
Thank you again very much.
You're welcome.
And Dr. Michael Hosokowa, University of Missouri School of Medicine, Associate Dean of Curriculum, talking about problem-based learning. Again, I'm Jay Short. Thank you for staying with us today. We'll see you next time. Thank you.